Hi, welcome. How are you today? Okay. All right. Well, I'm Nurse Elo, and I'm going to be taking care of you. My file here says that you're having some pain and sort of pressure buildup feeling in your face and neck. You want to tell me a little bit about that? Okay. Okay. Yeah, I see that. All right. Okay. Well, my job today is going to be to sort of assess the area. I'm going to be giving you a bit of a massage, kind of, in your face, around your ears, and down your neck some. And what we're gonna hopefully do with this massage is just relieve some of that tension and tightness that you're feeling. And I'll be taking a few notes to just sort of report what I see, what I find, what I feel, especially. And the doctor will look those over and make a diagnosis or prescribe any necessary medications or anything to get you, back to normal. Okay. Well, if you don't mind, I'm gonna come a bit close to you today. Is that okay? All right, and I've got some gloves on here to just sort of protect us both. I'm going to be using a bit of an essential oil blend here. I'm just going to start off by rubbing it on your face gently, and it's going to provide a sort of, better gliding motion since these gloves are less of a they have more friction when you touch the face, right? I don't want to be leaving you with rug burn on your cheeks here. So does that all sound okay? Okay, great. Well, if you have any questions throughout the process, don't be shy to ask. I will be happy to answer anything to the best of my ability. Okay? All right, so just before we get started here, I'm gonna place this on your chest. Can you take a deep breath in for me, please? Good. Again. Good. Again. Okay. Here we go. Good. And I'm gonna get one more here. Okay. Any pain there? Feels normal. Okay. Sounds pretty good. I'm going to put this on the center of your back, and I'm just going to have you count to 5 for me. Okay, good. 1, 2. Good, excellent. Okay, that sounds good. You sound pretty clear of any internal sort of liquid blocking anything that sounds raspy or nasty. It sounds really clean and clear in there, so I'm just going to make a quick note of that. Okay. Do you have any allergies that you know of? Right. Yeah, because sometimes the change of season, especially, can create a lot of these more tender sort of feelings like you're describing. Okay, okay. You get some sneezing sometimes. Okay. Do you work inside or outside? Okay. Any change to where you work lately? Have you changed buildings or had anyone new sitting next to you? Been exposed to any pets or? Okay. Has your diet changed at all recently? Started or stopped eating anything that you usually do? Okay. Okay. All right, so like I said, I'm gonna just apply some of this. It's gonna feel a little cool on your face. It's just got a nice little metal roller here. And I'm just gonna put it in some marks around, and then I'll spread it out with my fingers as we go along, okay? So this has a bit of coconut oil, which is gonna act like the propellant and allow me to really glide across your skin. It also has some orange peel extract, which is just to invigorate the skin. And finally, it also has some peppermint oil, which is going to help with some of this puffiness and inflammation that we see. Just going to get along your jawline here and into your neck. Alright, and I'm going to do right behind your ears. Is that okay? Okay. Get just a little swipe here. And on the other side as well. Okay. Alright. I feel nice and cool. Yeah. I actually really like these essential oils. They're nice. Sometimes I use them for myself too. Alright. You all set? Not nervous, right? Okay, that's gonna be totally fine. So you're in very good hands. Quite literally. Alright, so I'm just gonna start here around the outside of your nose, and I'm gonna pull gently with a little bit of increasing pressure. Just pulling away from the inner corner, or sort of below the inner corner of your eye, sweeping around to the outside. And if at any point in time you want to close your eyes, that's fine. If not, you can sort of just stare off wherever makes you comfortable. You don't have to look into my eyes or anything. Just do what feels good to you. I know it can be uncomfortable to have someone right up in your space like this. Okay, I'm gonna do some sort of smaller strokes and press, and little tiny little movements and press. Any pain? Okay. Work my way out across your cheekbone here. Press. Okay. Good. We're gonna do above, so we just did below. Now we're gonna work above your eye hair, sort of along your eyebrow line. Maybe a little bit higher too. Okay. So let's start with those sweeping strokes to the outer corner. Any pain here? Is that pressure okay? Good. Gonna tap a little bit. Okay. And the reason why we're doing the eyes first is because I feel like when you have pressure building up around your eyes, it can be incredibly uncomfortable. And I'm going to be using larger strokes almost with all of the 4 fingertips here, just including my thumbs, coming around your face to sort of move this fluid buildup down and through your neck. So I want to make sure that we don't add any increased pressure on your eyes, cause any headaches or anything like that. Okay, so we're just gonna kind of clear this area first. Make sure that we don't cause any further distress in a few moments. Okay, can you close your eyes for me for this part? Does that feel tight? It does. Okay. You can open again if you'd like. Okay. Can you feel any difference when I press here and here? Okay. That didn't hurt, did it? Okay. Good. I'm gonna do that one more time. I'm gonna press here. 2, 3, 4, 5. And then here. 1, 2, 3, 4, and 5. Gonna work out a little bit more to the corner of the eye here. Don't worry, I'll be very careful not to poke you in the eye or anything. I know a lot of people have fears of things like that. Oh yeah. Not everybody. But some people can't even stand to look at someone else touch their eye. I think most people have just a sort of reasonable boundary about things like that, though. It is a vulnerable area, so it makes sense to worry, especially in more severe cases. But I will not be touching your eyeball. I don't want to, don't worry. Okay. Alright. I'm going to use my first 2 fingers here and just sort of massage your temples a little bit, but I'm going to sweep that down to the jaw. So I'm just going to go around, press, and pull down. Okay? Here we go. Do these little circular motions just to get some of that fluid moving, and then we'll hold. 2, 3, 4, 5, 6, 7, 8, 9, 10, and pull down. Okay. Ready to do that again? Did that hurt or cause any tension? Okay, let me make a little note of that. How does your neck feel? Are you tense at all through here? Okay. I was just gonna say, if you do start feeling any tightness or if it increases, you can kind of just sort of not big rolling of the head, but just tiny little circles or just back and forth. You can turn your neck a little bit. Nothing out of control, very deliberate. And that will help loosen your shoulders a bit. Okay? Yeah, anytime. Okay, so and where did you say you felt that little tweak a second ago? Kind of just before the ear here. Okay. Do you grind your teeth at night? Okay. Because sometimes when we have that tension in our jaw joint where that meets there, which is kind of the area that you described, that can be related to TMJ disorder. Yeah, so just made a note of that just in case there. Okay, it's good to know. Alright, so we're gonna come around again with these little circular motions and press 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Pull it down. Okay, great. Are you feeling any relief? Eyes are starting to feel a little better. Sometimes it takes a few seconds to feel the effects because it is so much pressure. I can feel the tightness, in your skin. It might take a few moments to really settle in a way that you can feel. Okay. And hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and pull down. We'll do Spanish next. Just switch it up a little bit. Just gonna pull a little more of that fluid to the temples. Press and pull. A little bit of pressure here. And pull it away. Up top. A little pressure. And pull it away. And 2 fingers here. Pressure, pressure. And pull. Okay. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And pull down. Alright. Okay, I'm just gonna press now into your forehead here. Gonna put a lot of pressure, okay? Breathe. And release. I feel okay. Okay, this time, instead of just doing 2, I'm gonna do 4 fingers and I'm gonna line them up and press in. And we're gonna hold, okay, for 10 seconds, and then I'm going to pull down and around, okay? we're going to start clearing some of that forehead. Okay. This might be a little tense at first, but it's going to feel really good once we get through it. Okay. Alright, so let me line my fingers up here. I'm going to press in. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Pull down. Okay. I'm sorry, I know it's tight. Let me just massage here a little bit for a second before we do that again. Get your temples a little bit again. I'm going to use some more. Instead of doing pressure here, I'm going to use some sweeping motions instead, okay? Okay, you doing all right? Let's take a nice deep breath. Good. Okay, one more. Okay, good. You ready for the fingers again? Okay. Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And pull down. Good. And I'm going to pull up, press my finger right here in between, and pull up, press, up, 1, 2, 3, pull up, 1, 2, 3, and pull up. Okay, how's that feeling? Alright, and I know your head is probably all over the place and feeling kind of congested, but can you describe to me how you're feeling right now, just so I can take a little note? Okay. Right around here? Okay, that's kind of a major sinus area, also above the brow where we've been working. So we probably have to start doing some drainage kind of in this area. Do you have all your sinuses? Have you had any taken out? Okay. And do you ever get like sinus headaches? Yeah, okay. And is that in the winter, summer, spring, fall, or kind of you don't really know, or? Okay, okay. How's that jaw tightness? Still pretty tight. Is it tender? Like if I touch it right here? It is, okay. Sorry. I do love, bringing relief to people, but I feel bad in the process when I cause a little bit of discomfort. I think being uncomfortable is one of the things I hate most. In any sense. Okay, so we're gonna start doing some work down here now as well. I'm not through with your forehead. It's just a big space, and it can be quite painful, as we've discussed. So I'm gonna give that a break for a second. Try when you're breathing to kind of think about letting that oxygen and blood flow just circulate throughout your whole head. Think about your upper head as you're breathing. I know it kind of sounds silly, but it does sort of help to relax the area if you can just think about it and be mindful. Okay, alright, so first thing I'm going to do here with your sinuses is some sweeping motions, and I'm going to work from under the eye sort of downward into that cheekbone sinus area, and I'll sweep down around your cheeks to your chin. Okay? Alright, so let's start off here. Okay. And I'm just going to use the side of my finger kind of to press in a bit. Has this ever happened to you before? Not to this degree. Okay. Okay, now I'm going to use my fingers to just sort of tap a little bit in the area. And round down to your chin. Can you feel that kind of moving? Yeah. Okay. Now I'm going to go deeper with the pressure, so I'm going to use my thumbs, okay? And I'm going to press 2, 3, 4, 5, 6, 7, 8, 9, and 10. Pull down and around. Okay, we're gonna do that again. I'm gonna move slightly out each time. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Pull around. And this one's going to be on the outermost edge here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Did that relieve any of that there? Okay, good. So I'm going to start working a little bit around your ears and jawline too now. And as I do this, I'm going to sort of have my pointer fingers towards that front joint in front of your ear there, along your jaw. And my back fingers are going to be pulling down kind of behind your ears. And I'm going to use my thumbs to balance on your chin, okay? So we're involved all the way here. Alright, you ready? Okay, and I'm just going to pull down. Does it feel okay? Okay. I'm going to press pause and hold. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good. Okay. Just keep pulling here. Down. Can you feel that kind of ridge line behind your ears? Yeah. We're just sort of trying to smooth around that. Okay. Alright, I'm gonna press now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Alright. I feel like I can kind of see some of the reduction now really setting in under your eyes. That's feeling pretty good. Good. Okay. So I'm going to go back to some of those big sweeping motions. You may want to close your eyes for this if you're just worried about having my fingers come towards your face, but you don't have to. Like I said, I'm not going to poke you in the eyes or anything, but I am going to kind of use my whole hand, all my fingers, my palms even, to really start to pull all of this down towards your neck in like a more major way instead of doing some close fine work like we've been doing. Okay, and we're gonna just see how this settles in a second. Okay, all right, here we go. Pull this down. Cheeks a little bit here. And get your chin. Pull down through your jawline. It's really important. And behind your ears here. Okay. Does this feel okay? You can really feel it moving, right? Sorry, my mouth tends to hang open when I'm focused. I try to be mindful of it. Okay. I know that was a lot, so we're just gonna give it a second. You can take some deep breaths with me. Ready? Okay. Good. You're doing such a good job. Excellent. Let's do one more. Okay. And try to sort of give your shoulders a roll back and down. Yep. You want to feel your shoulder blades sort of sit on your back here. Keep these shoulders nice and drawn away from your ears. Make sure we don't have any tightness. Okay. Feeling okay? Alright. Do you want to just tell me again how you're feeling? Do a little check-in? Sorry, my computer continues to sign me out every few minutes. Okay. I'm ready for you. Okay. So dramatically reduced in the eye area. Okay. A little tightness in your temples. Would you say that that's a significant pain, moderate pain, or dull pain? Moderate, okay. How about through your forehead and through your sinuses that we talked about here and here? Feel some movement. Do your ears feel like they're draining at all? They do. Okay. Okay, well, I know that can be uncomfortable, so let's pay some attention to that right away. I'm just gonna work the area around the ears and around your jawline here. And we're gonna try to pull some of this drainage down into your neck. Can you let your jaw just kind of hang loose for me right now? You don't have to like stretch it open. Good. Just nice and kind of relaxed there. And pull down. Good. Pull down. Gonna press now on that jaw joint, and I'm gonna do firm pressure coming down, okay? So just breathe for me, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Pull down. Good, good, good. Other side, we're gonna hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and pull down. Okay. Alright, we're gonna really work down into the neck now. I'm gonna kind of be tapping and using minimal pressure to sort of rake that drainage down, okay? Does that feel any better? It does. Good. Okay. Good. Okay, so it's a good news, I should say, that this kind of massaging technique is helping, because that means that we may not have to rely so heavily on putting on some sort of medication, which, if I remember right, you're not a huge fan of taking that kind of stuff. Yeah. I know you want relief, though. Right. Well, it's possible that the doctor might end up prescribing you something to, it would be like a small pill that would be fast acting, in the event that, let's say you have something to do that day, and if we put you on some sort of a treatment program, which this is just what I'm thinking might happen. I'm not really qualified to say for sure, but just based on what I've seen and what I know, I think that you might end up on some sort of a regimen, like a number of weeks long, that you'll come and get sort of just a face massage, neck massage that will help with the process of draining all this fluid and removing all this like tension under the skin. But he may also prescribe you a small pill of some sort that will sort of counteract the effects in a short-term situation. If you have something you need to do, or just want to enjoy your day that day and you can't get around, or your massage isn't for a few days away, because sometimes these things just sort of flare up, and since we're not totally sure what the cause is yet, until we could eliminate or in some way moderate that cause, we definitely want you to be able to still live your life normally. Right. So that's what I'm thinking, just based on what I see, but I'm not in a position to say really what's causing it. Just kind of what I can see, and based on my training and what I've seen with other clients as well. Now, this isn't super common, I guess. I mean, I feel like the people who usually have this are either people who have had allergies all their life and they're just sort of getting worse due to a shift in the weather, or conversely, people who have adult onset allergies related to grasses, pollen, and other sort of dander. I definitely don't think you have anything to worry about in terms of like life-threatening. Right. It's certainly uncomfortable, and no one's gonna minimize that, for sure. I've never had it to this extent that you do, but I've definitely had small incidences. Like, I'm allergic to a lot of seafood, and I know how uncomfortable and swollen I can get if I have some interaction with those things by accident. So I can only imagine how it feels to have this kind of all over your face, and I'm sure it's very exhausting and frustrating. So I certainly feel for you, and that's kind of why I am giving you my humble opinion, because guys, I know it really stinks to leave the doctor's office and feel like you have no answers. Just want you to know that you are okay. Gonna be fine. Even if it's uncomfortable, you can certainly make it through this. Your body can withstand this pressure. And we're definitely gonna get you in as soon as we can. I'm gonna give these results to the doctor today, right after you leave. They're all, on my computer, and I'm gonna send them straight over. And he'll make his decisions. Have you met with him already? You have? Okay, good. He usually does like a preliminary meeting to just know your face and make his own sort of notes and thoughts before he gets more information. And if he needs to see you soon, we'll just give you a call today. Or if you'd prefer, we can shoot you a text message. I get phone shy too. Well, I guess it depends on what I'm calling about. But if someone's calling me, that's definitely not my favorite scenario. So we do offer texting option as well. Gonna get around your ears again here. Pull into your neck. It's starting to ease up there. Good, good, good. I'm so glad. I really do see like a visible notice, or reduction, I should say, in the puffiness. I can notice. Massage your little chin here. I know, that always feels surprisingly good. Chin is so neglected. Okay. Alright, time for our last check-in. Slide back in here. How are you feeling? Okay. And take a few deep breaths for me while I'm writing here, yeah? Good. Would you say the pain is now dull, moderate, or significant still? Between moderate and dull. Good. How's that tightness along the sides, kind of your face? Better. Good. Okay. And how does your forehead feel? You had mentioned earlier that it felt cloudy. Do you still feel kind of cloudy? Less so, at least. Okay. All right. Do you have any other sort of notes? Sorry, I'm just kind of looking you over. Do you have any other sort of notes that you'd like for me to add? Okay. So you still have some tightness in around your nose? Okay. Do you feel like that's gotten less at all, or is it still kind of the same? It's about the same. That could be good information though, because since we've sort of been through the whole massage, if that area is still feeling tight, that could really point the doctor towards thinking that this might have something to do with these sinus cavities, because they do tend to sort of radiate some pain towards the bridge of your nose from time to time. Right. So what I'm going to just recommend for right now, I'm going to send you home with some eloASMR. And it's a dye-free. Can you take pills? Okay. Yep, I have that in dye-free. And essentially it's just gonna loosen up that area. It might take about 15 minutes to kick in. Yeah. And you can take that again tonight before bed. You should get a call from us though, before supper time probably, to let you know what the next steps are. And we can get you scheduled in from there if we're doing more massages. They're all covered for you, so it's not gonna be any crazy expense. And this eloASMR we hand out for free as well, because we have just these sort of trial bottles that we get from the reps that come by. So it'll last you, if you take it once, I wouldn't say take it more than twice a day, because taking any sort of medicine like that can impact your liver, and it's just not good to overdo it with any sort of medication. So I would say no more than twice a day, maybe once in the... Do you feel like it starts the second you wake up, or is it kind of as the day progresses that you really get that pain? Okay, so maybe around mid-morning, take your first dose and then take another one before bed. And it's just 2. Good. And that should just hold you over in a non-serious way, until we get you in. Okay. Did you have any other questions for me? Good. Okay. Well, it was really great chatting with you and seeing you, and I'm sorry that you're dealing with this, but we're definitely going to get it fixed up as soon as we can. So, are you feeling a bit better though? Good, I'm so glad to hear that. Well, as you know, at Quake, we have beds in every room. You're welcome to take a little lie down if you'd like before you leave. There's no rush. You've already checked in with the front desk on your way in, right? Okay, so you are able to leave whenever you feel comfortable. There's some water and some snacks there as well if you're feeling a little low energy. Help yourself, and you can just shimmy on out whenever you're ready. Okay. All right, well, I'll leave you to it.